What if the brain, that sophisticated control center of our bodies, suddenly short-circuited? This is not a premise for a science fiction novel, but a reality for millions of people worldwide living with epilepsy. Epilepsy is a neurological disorder where the brain activity becomes abnormal, leading to periods of unusual behavior, sensations, and sometimes even loss of awareness. The brain, a complex organ, communicates through electrical impulses. In epilepsy, these electrical signals are disrupted, which can cause seizures. The causes of epilepsy can be manifold. Some people have a genetic predisposition to the condition, while others might develop it due to a traumatic brain injury, stroke, or an infection like meningitis. In many cases, the cause remains unknown, making epilepsy a medical enigma. Symptoms of epilepsy vary widely. Some people stare blankly for a few seconds during a seizure, while others may twitch their arms or legs. Seizures can also be frightening, with some individuals losing consciousness and convulsing. However, having a single seizure doesn't mean that a person has epilepsy. At least 2 unprovoked seizures are generally required for an epilepsy diagnosis. Diagnosing epilepsy involves a series of tests, including neurological exams and blood tests. Doctors often use electroencephalogram tests, or EEGs, to monitor the electrical activity of the brain. Other tests like CT scans, MRIs, and PET scans help doctors to visualize the brain and identify any abnormalities that could be causing seizures. Living with epilepsy can be challenging, but treatments are available that can help manage the condition. Medications are the first line of treatment, and for some people, these drugs can reduce or even eliminate seizures. For others, surgery, nerve stimulation therapies, or dietary therapies like the ketogenic diet may be effective. However, it's important to remember that everyone's experience with epilepsy is unique. What works for one person might not work for another. That's why it's crucial to consult with a healthcare provider to determine the best course of treatment. In conclusion, epilepsy is a neurological disorder characterized by abnormal brain activity leading to seizures. Its causes range from genetic predisposition to brain injuries and infections, and its symptoms vary widely. However, with the right diagnosis and treatment, people with epilepsy can lead fulfilling lives. Understanding epilepsy, its causes, symptoms, and treatments is the first step towards creating a more inclusive and supportive society for those living with the condition. Much like the brain's intricate web of connections, our collective knowledge and empathy can help illuminate the path forward in epilepsy research and care. Remember, epilepsy is not a barrier to living a full and meaningful life. With understanding, compassion, and the right treatment, individuals with epilepsy can overcome the challenges they face. So let's continue to learn, empathize, and support those living with this complex condition. That's it for today's deep dive into epilepsy. Stay curious, stay informed, and stay compassionate.